Don't just test what your doctor can bill with your insurance, because you're not going to get results. 100%, honest to God's truth, you will not get results with the blood work that your doctor is going to recommend. Guarantee it, because they're missing everything. All right, everybody, welcome back to another episode of the Doc Jock Show. So today we posted a sticker on our Instagram stories. And so what we're getting out of this is, what are we talking about? PMDD. All right, so PMDD by definition is basically a more advanced, more depressive state compared to those women who suffer with just PMS. Now, the different things you can have the different mood shifts, you can have mood swings up and down, you can have extreme sadness, you can have anger, irritability, hopelessness, you can have bloat, weight gain, really just struggling for life overall. And this is a sign that you may be dealing with a condition known as PMDD. What about weight gain? What about blood clots, right? Before we really dive into this is not something that women are supposed to just deal with. Right? As a whole, in my opinion, society has just been like pigeonholing women to just feel terrible their entire lives. You can have PMS symptoms or PMDD when you're a teenager and they immediately put you on birth control. Right? And 100% of birth controls is going to lead to some form of depression. So then you get off birth control, and if you don't fix the hormonal damage that was there to begin with, or you still live that same toxic lifestyle, or you have just the overall damage from the birth control being in your body, then that can lead to more issues down the line. And so what we're seeing here is that parents or wives, moms, they're going through life on birth control, then they're able to get pregnant. And then as soon as they come out of that pregnancy, they have that postpartum depression, the postpartum blues. And their cycle either doesn't return back, or if it does, it comes back in a very irregular fashion, and nobody really understands why. So then we label diagnosis on it, right? Postpartum depression. But blues. Is it because that patient, that person has no spousal support? Are they a single mom? Do they not know that they shouldn't be feeding their kids dairy, and so their kids are going and screaming all the time? What if they're feeding them soy and the baby's having rashes, or they feed the baby formula, which is just toxic milk? What is it that's causing this mom to be so stressed out? Now, with medical doctors, you're basically going to get medication. They're not going to do surgery or anything for it, but you're going to get some form of a medication. And that medication may be something like a Xanax or like an antidepressant, or you can have an anti-anxiety medication, or they'll put you on birth control, which again, 100% of all forms of birth control lead into depression. And in fact, I have a doctor that I coach. He was talking about this the other day. He had a 28-year-old, and he showed me her hormone results, and I about dropped, like my jaw was like, boom, down on the ground. I was blown away. And he was like, what are you seeing with this? I'm like, dude, like, I saw the adrenals. Adrenals were completely shot. I saw that the patient was on Xanax. I'm like, well, there's that. And then I'm like, well, let me see what's going on with the estrogens. And he sent me a picture of that, and boom, testosterone was dropped, completely bottomed out, and estrogens were through the roof. And 28 years old, going through depression, going through all of these mood disorders, all due to having hormonal imbalances. She didn't understand it. The doctors didn't understand it. Her PCP, her endocrinologist didn't understand it. Nobody really wants to just deal with this. And what I mean by deal with it is nobody really wants to fix it, because it takes time. It takes proper lifestyle analysis. And the person reached out to me, like we got into it back and forth. She was asking a bunch of questions. I'm going back and forth. And she was like, it's a lot more depth than I thought. I'm like, yeah, like this is the level of depth that I feel every woman should be armed with, the level of knowledge that every woman should have, because this is their hormones we're talking about. And I still feel, and I still say that every single young girl that goes through puberty should have a hormone test run, a Dutch test run as soon as they get their period. Wait maybe like 3 months to figure out what the cycle is like. Run the Dutch. Run it. Because then you're going to be able to figure out, are there any types of issues with the hormones at a very young age, which can then set them up for failure in the future if not corrected. right? And by failure, I mean that she's going to be stuck on birth control. She's going to have to miss sports. She's going to have to miss tests, right? Because these women, they're having such bad endometriosis or PCOS, and it feels like their intestines are just ripping out of them. Her organs are just ripping out. And like, oh, sorry, teach, I can't take this test. I'm in so much pain. And then what does medicine do? They're like, well, you have this pain. Let me give you this Advil, Midol, right? Excedrin. I didn't even know what Midol was when I was growing up. I'm like, what the heck is Midol? Midol was like the menstrual medication. Like I met a lot of women who were like, oh, I take Midol for my cramps. I'm like, what the hell is that? So you're medicating, you're damaging your gut further. You're going to have more hormonal imbalances due to it. And it just keeps compounding time and time and time again. So PMDD and even PMS, these are clinical conditions. All right, they're clusters of symptoms that when bad enough will evolve from PMS to PMDD. So in my opinion, if you're a woman and you're suffering with PMS right now, in the future, maybe it could be 5 months, 5 years, whatever from now, 5 weeks, 5 months, 5 years from now, you could then develop into PMDD. And then good luck in menopause. Your hormones are imbalanced your whole life. You get to menopause, you're like, oh my gosh, my hot flashes are horrible. I feel terrible all the time. I have no sex drive. I'm angry. I'm this, I'm that. Could have all been solved if we tested your hormones as a young kid. So moms out there, dads out there that are listening to this is very important. When your daughter hits puberty, give her about 3 months and reach out or run a Dutch test on her. Reach out for me and you can get one of these tests. You don't have to be a patient of mine. Just call and test so we can see what's going on with the hormones. Or at least you can see what's going on with the hormones. If you need me to read it, I'll read it, but it's pretty easy to see. The gauges are bright, they're colorful, it's hard to miss. Now, when it comes to what causes PMDD, right? There's multiple causes. Some people will say, hey, it's an issue with hormonal imbalance, right? And hormones are secondary to some other form of problem, right? It's important to note that because we have 3 main organ systems in the body. We have the neuroendocrine, so the adrenals and the hormones, the GI system, and the detoxification system. All 3 of those systems can cause PMDD. Because we start with inflammation, then we have catabolic physiology, then we have insulin resistance, then we have oxidative damage. It goes in that cascade of effect. It starts and ends that same way every single time. Goes in order. Each one stacks upon each other. So when it comes to PMDD, if your doctor doesn't talk to you about your diet, then your PMDD symptoms are never going to go away. You're always going to suffer with them. Because what if you're eating inflammatory food? What if you're eating processed sugars, dairy all the time, gluten all the time? Then you're developing gut infections. We have candida overgrowth or yeast overgrowth in the gut. We're going to have leaky gut. That's going to push bacterial toxins or different other endotoxins out into the bloodstream. You're going to be inflamed. Inflammation soon after is going to lead into catabolic physiology, then insulin resistance, then oxidative damage every time. So it could be from hormonal imbalance, but remember, when we're talking hormones, we're not talking about hormones in particular, right? We're talking about what's making the hormones express in that certain way. Now, there are certain conditions, don't get me wrong, where we can have, failure of the gonads where they just don't produce anything anymore. I understand that there's things that can cause that to happen, but something caused that to happen, right? Is the damage permanent or is the damage reversible? When it comes to PMS and PMDD, more often than not, they're reversible. You just have to find the hidden triggers as to why. So when we talk about the neuroendocrine, so we'll go in order here. So we'll go neuroendocrine and we'll focus on the adrenals. When it comes to PMS, more often than not, we're going to have issues with progesterone pro-gestation. It allows you to get pregnant. It allows you to have your cycle. And when we have this pregnenolone steal or this cortisol steal, our progesterone is going to get tanked. It's going to go down. It's going to be very difficult for that woman to ovulate properly and have their cycle properly because they're so stressed out that all of their progesterone is getting ripped out and going to cortisol, right? Or we have an infection, it's going to cortisol and then it's converting over into cortisone because the body's trying to put out that fire. Now, if I gave that patient, or if a medical doctor gave that patient progesterone, is that going to fix the problem? 100% of the time, no. How much percent of the time? 100% of the time, no. Right? Because if I give somebody progesterone and then I take the progesterone away and I never fix that underlying stress or that underlying infection, progesterone is just going to tank again. It's going to go down, right? Now, another important piece of this, we have the stress, okay? So we have overall stress, internal stress, we have toxin stress, we have environmental stress, physical stress, we have working out too much or working out too little. All of this is going to have an impact on the neuroendocrine system 100% of the time. It's impossible not to. So again, if we want to get to the root cause of this stuff, we have to first analyze the adrenals, analyze those hormones, and figure out what the picture actually looks like. Okay? Now, on top of that, we're like, okay, so we've got the neuroendocrine problem. What about if we're talking, so neuroendocrine, we're going into hormones now. Okay? And we see a Dutch test, a beautiful Dutch test come back, and it's not so beautiful, and the results are all over the place. Progesterone is down, and estrogen's through the roof. And the patient's like, I don't know what's going on. I have all these symptoms of PMDD. I feel terrible. Well, low progesterone can give you anxiety, can give you depression, can give you cramping. Not only that, but it can also push up estrogen dominance. So there's typically going to be some weight gain associated with this as well. Now, this isn't 100% of the time that you're going to gain an abnormal amount of weight, but it's very common that this does happen, that this does take place because of this response. Estrogen going up, progesterone going down, going to be a problem. Now, we'll say progesterone aside, we'll say progesterone looks great. Okay, progesterone's beautiful. And you look at your estrogens, you're like, okay. So you're learning right now that progesterone is good, but you're learning right now that there are many other estrogens than what are tested or what is tested in your standard blood work. You usually get one. Estradiol, that's it, E2. If it's E2, that means there's others. So there's an E1 and there's an E3. So E1 is estrone, E2 is estradiol, E3 is estriol. Those are called your primary estrogens. Now again, so your progesterone's perfect, but we look at your estrogens, all three of them there, and we see they're all red-tipped high, incredibly high, right? We look upstream, we say, oh, well, testosterone's perfect, your DHT is perfect, DHEA is perfect, DHEA sulfate's perfect, everything's good over there. But right here, we have an issue. That is a phase 1 problem. We're red the whole way through, and we look down at the metabolites, which are also known as estrogens. Fun fact, there's more. And all of those are yellow or just within normal range. It means you're not breaking down the estrogens that are there, another form of estrogen dominance. It's a phase 1 problem with estrogen dominance. Now let's migrate. Let's go to phase 2. So when we have phase 1 problems, we have 3 different pathways that they need to go down. Okay, and I'm going to try to talk slowly through this. And these are numbers and words that I can almost guarantee you've never heard of unless you've run a Dutch test. Okay, because you can't get these metabolites in blood. That's why urine is huge. Really, blood is horrible when it comes to hormones. If you want to get a serum test done, go for it. There's certain markers that you can get, sex hormone binding globulin that you can get, and some other markers. Sure, you can combine the two of them. But in terms of hormones, Dutch test all day for the hormones. All right, so say we have our estrogens and they are breaking down. We're going down to 3 pathways here. So we have a phase 1 problem, they're not breaking down. Then we have another example where all 3 of the estrogens are perfect within normal range. Estrone, estradiol, and estriol, beautiful pictures. And then you look down at the 3 pathways and we have 16-hydroxy, which you'll see in a blue line. The 16-hydroxy is high. And then you see 4-hydroxy, which is a bad pathway, it's red. That's cranked up high. And we have 2-hydroxy or 2-OH, E1, and that's low. Well, your body's favoring these inflammatory pathways. It's favoring the 4-OH pathways. And you can see a little pie chart over there say, hey, out of all the estrogens that are being broken down in phase 1 metabolism, you're favoring cancer, more or less, right? This would be another sign that we have an issue with estrogen, right? Now, when it's a phase 1 problem and it's going down certain pathways, inflammation is going to be a huge driver of this stuff. So we're like, well, what do we do? You know, some people are like, if you have an estrogen problem, you just need to take DIM. Just take DIM all day. Just DIM. DIM is a phase 1 support. Can DIM do tremendous things? Absolutely. Research loves DIM. It's anti-cancer stuff with it. There's so much that DIM can do. However, if we don't know what's happening upstream, right? Or right, you get a blood work done, you get some blood work done, and your estradiol or E2 is low. You're like, oh, well, you don't have an estrogen problem. And you're like, listen, my breasts are tender every single month. I'm having clotting, I'm having bleeding, I have all this excess weight gain. What do you mean my estrogen is low? Where is it? Where are the estrogens at? Are they actually low? Or are they going to E1 and E3? Or are they over-converting down into your other pathways? Now, if your estrogens are low across the board into phase 1s, you would not want to do a detox, and you definitely would not want to do DIM, because then it can push the range into postmenopausal. Too little estrogen means less cell growth, which you'd be like, oh, that's great. But then it starts to pull from your bones, and you start getting osteopenia and osteoporosis, right? Your joints will get all achy. Call it the bodybuilder effect. You take all these, aromatase inhibitors, and you take all this DIM supplement, and you have no estrogen left, and their joints are like, and then their tendons snap. Now that's extreme examples, but it's real life stuff. Okay. So say we have no estrogens, and then we look down at the phase 1 metabolites, okay, 2-hydroxy, 4-hydroxy, 16-hydroxy, and you're still favoring the red pathway, favoring the 4s. When you're favoring the 4s, that's going to be your more cancer-causing pathway. If it does not get detoxified or bound or detoxified, it forms into what's known as 8-OHDG. This is like full over-oxidative damage in the body. This isn't just talking about estrogen anymore. It binds to the DNA and damages your DNA. This is really bad, and it's very common. Not normal, but very, very common. Inflammation triggers these pathways, right? So we have to do things to try to pull out, reduce inflammation, channel it down the 2-hydroxy pathway. Okay. This also wouldn't be an issue or a case where I'd say, hey, you know what you should do? We should definitely raise up your estrogens and get them back to normal, because they showed low on a test, right? This is medical mindset, this allopathic stuff. It's low, make them high. Well, if the estrogens that you do have are going down cancer pathway and I give you more estrogen, you're going to build more cancer. Not a good day. Not a good day's work. Not at all. So we want them to go down the 2-hydroxy pathway. So that's all the phase 1 stuff. Now let's talk phase 2. Phase 2 is where methylation, okay, is going to come in play. Methylation is basically, you need methyl groups or methyl donor groups to be able to bind to free radicals or estrogen to get them out of the body. So 2-hydroxy turns into 2-methoxy because of the methyl group that was added. Now, this isn't a class on biochemistry or anything, but this is another thing where, say you're taking DIM, you're shoving all of the estrogen down, or the estrone, well, really all of the estrogen down the 2-hydroxy pathway, but phase 2 is sluggish. You're having all of this excess estrogen, and you're causing this built up back pressure, and then you're spilling over into 4-hydroxy. Then you're going up and spilling over into the 16-hydroxy. Okay, and you just keep going over and over, and then it spills over into your DHT, and you can't get rid of these hormones that you're trying to forcefully get rid of just by using DIM. Now, this could be an issue where we have a genetic SNP, where it could be an MTHFR case, okay, MTHFR, mother effer, or it could be a COMT deficiency, or it could be a vitamin deficiency. You could be deficient in B6 or magnesium, which, by the way, birth control has that effect. It robs your magnesium and robs your B vitamins from you. Alcohol also does that. It robs your B vitamins. Okay, it can cause liver damage. So even if you're trying to forcefully try to push all the estrogen out, you're like, I have all this estrogen dominance, I'm going to take DIM, and you shove it down the pathway, and you're like, oh, what do I do now? Well, now you need your methyl donors, and you need some methylation work to get these guys out of the body. You need to detox them. It's the phase 2 stuff, right? Then there's a third form of detoxification. Now we switch tests that we're talking about. We're talking now about stool tests. Now, on a stool test, on the 4th page of the stool test that we run on the GI map, and you can get it on my store, you can actually get some testing now, which is pretty awesome from Group of Health. But anyways, I'll try to put the link in the bio here, or link in the show notes. But when you have a stool test pop up and you have high beta glucuronidase, I laughed because it's just a fun word to say, beta glucuronidase, then this is a portion of what they call estrobolome. You're having a difficult time with excreting those estrogens out of the body. Okay, so phase 1 and phase 2 detoxification take place in the liver. Phase 3 takes place in the colon. It needs to get out. Now, if we have high beta glucuronidase, it's going to take the estrogen you beautifully packaged And it's like you have a fresh package that just came in. You're like, I'm so excited to open it, but I'm going to wait 2 days to open it. And your kids just, go through, or trash can. Let's do trash. So you pack all the trash and you're like, all right, I'm going to take this out to the trash can and get rid of it. And your kids or your dog come through, rip the bag open, start throwing shit everywhere. And you're like, what happened? This whole house smells like crap. It smells terrible. It smells way worse than what I thought it was in a garbage can. What the world? It's pretty similar to what happens when beta-glucuronidase is high on a stool test. There's another issue when we have phase 3 of estrogen detoxification. This is also why we cannot fix and balance your hormones if we do not first take a look at your gut as well. Not first take a look at, but make sure that we take a look at your gut. Because if you're not pooping, you're not getting rid of your estrogen. What's that going to do? It's going to build more candida or more yeast, and then it's going to push up more estrogens. You're not going to be able to get rid of it. So you can have people with gynecomastia, men. This happens all the time. Beta-glucuronidase is a cancer marker. Okay, so say you have high 4-hydroxy or high 8-OHDG, you're not methylating it properly, and then we look at a stool test and you have really high beta-glucuronidase. This is a recipe for disaster. This is a recipe for cancer, or at least fibroid growth, because estrogen makes things grow. All right, and when beta-glucuronidase throws it back into the bloodstream, it's going to hop and go anywhere throughout the body. Estrogen can make cells grow. So if it goes into the cancer cells or the cancer area and boom, you start feeding it more and more and more estrogen, a lot of cancers are estrogen receptor positive, which means they respond to more estrogen and they grow with more estrogen. So we have to make sure that we stop this stuff. So it could be coming from a hormonal issue, whether it's a phase 1, phase 2, or phase 3 issue, which phase 3 would then be into the gut, or it could be an issue with overall detoxification being bogged down. So having what I call like a toxic overload. Now, when we breathe air, we drink water, or we eat food, there are certain levels of toxins that we bring into our body every single day. And our detox organs need to be tip-top shape because they need to be able to handle the workload of what you're bringing in. So supply and demand need to be 1-to-1. If we don't, then we become overwhelmed by what's actually happening in our body, and we start having issues with that. The liver starts bogging down. Okay, and then we start seeing a bottleneck with that phase 2 detoxification. And again, not going to be a hormonal problem. We have too many hormones, but it's because we're not detoxing in the liver. So it's really important to understand how we differentiate these things, which also is why, again, doctors aren't going to go after this stuff. There's a lot of questions and a lot of work that needs to be done in order to fix this and make it go back to normal. Because if you're diagnosed with PMS or PMDD, number one, it's not fucking hereditary. I'm going to swear when I say it's not hereditary. I'm sick of that freaking remark. Oh, my parents had it, or my mom had it, and my grandparents had it, and now I have it. No, it's bullshit. You're lied to. Your doctor's lying to you. It has nothing to do with that at all. Now, could it be because there's a genetic SNP with a mutation with the MTHFR or with COMT? Okay, I'll allow that. I'll allow. But it doesn't mean that's what you have to suffer with for the rest of your life. You just need to take certain aids to help in that, okay? Now, again, when we're talking about the medical realm of treatment with this, we're talking usually birth control to try to regulate these symptoms. We're talking SSRIs that never freaking work. And I still don't understand why SSRIs are even around. 90%, right? I laugh as I say it, but 90% of your serotonin is produced where? In your gut. In your gut. So if you have PMDD, mood disorders associated with it, you have manic depressant states, and somebody tries to give you an SSRI and they don't first look at your gut, that should be medical malpractice. 1000% of the time. Because you can't have mood disorders if your gut is intact. It's impossible. All right? What about your adrenals? Your adrenals will impact your gut too, and your gut will impact your adrenals. Fix the gut, fix the adrenal, fix the 3 organ systems, and you won't have these problems anymore. Which means doctors make far less money because you're not a consumer for life. Now, if you get diagnosed with PMDD and they put you on one of these drugs, they never say, listen, we're going to put you on Prozac for 3 months, and then you should be good. We'll take you off of it. No, that's a lifetime medication. Lifetime. Money in the bank. All they have to do is make sure they see you and refill your script. That's it, right? You're a druggie for life. What about birth control? Let's keep you on birth control. Let's do it. And then you get to your postmenopausal phase, your hormones are so jacked up, you're like, oh my gosh, my hot flashes are terrible. Guess what? I'm gonna make more money off you. Let's just rip out the reproductive organs. Let's clean house. Let's get those things out. You won't have uterine cancer. You won't have cervical cancer if I just rip all those things out, right? You're like, oh, cool, great. Now there's some instances where, there's huge tumors and stuff, and for preservation and getting things back to normal. Yeah, those procedures are emergency type procedures, but they're not something that you should have to deal with, right? If you fix your hormones, you fix that underlying cause, then all those symptoms start to go away. So again, birth controls, no bueno. SSRIs, no bueno. Anti-anxiety medications. This was a fun one. So I had a list of side effects here. Sleepy, fatigued, zombie. You're in a zombie state. And men, I feel like this is motivation enough for men. You're put on an anti-anxiety medication like Xanax, Klonopin, diazepam, Lorapam. Guess what? You got yourself some ED. Enjoy life. Tell me that's not going to cause a worsening of symptoms, newer worsening symptoms. If I was anxious before, okay, and whether you're married or not, and you go to approach the bedroom and you're like, I'm going to be pushing rope here today. This isn't going to work. That's going to exacerbate the situation. It's going to exacerbate the condition. You're not going to want to have sex. You're just going to stay away from that, right? It's going to throw everything off. And again, when you're over converting with these SSRIs as well, and you're over converting these things into estrogen, you're going to have decrease in testosterone, which is going to put your risk of heart attack and heart disease up even higher because testosterone is cardioprotective. Then you sandwich that over, you're going to develop more risks of cancer because you work with more estrogens, right? So everything throws everything off when not properly corrected. So don't just be quick to medicate these things because you're not going to get the results that you're looking for. I guarantee it. Okay? Work with these phases of estrogen detoxing. If you do that, you will see tremendous change. Test first, test properly. Okay? Don't just test what your doctor can bill with your insurance because you're not going to get results. 100%, honest to God's truth, you will not get results with the blood work that your doctor is going to recommend. Guarantee it. Because they're missing everything, right? It's like trying to put a puzzle together, right? And we have all the pieces. We ask all the questions. 100-piece puzzle. We have 100 questions we ask you. We build influence on that. We're like, cool. Address all that. Boom. We get a beautiful picture of who you are, right? And then you have medical doctors that come in and they're like, well, I was going to bring the puzzle pieces, but I forgot half of them. And so we'll put some of these pieces together. We'll make it work. I don't know what that is, but I'm just going to guess. I'm just going to assume that this is what you need. Good luck. There you go. Right? That's what they do 100% of the time. So if we miss the boat here, we don't address these three organ systems, women, you're subject to deal with this the rest of your life until you get a hysterectomy and they pull everything out. And then you're left with worse symptoms too, because guess what? In menopause, women rely on their adrenal glands to produce some of their sex hormones. If the adrenal glands were burnt out to begin with, and that's why you had PMS, PMDD, and then we rip out the reproductive organs, and then we're fully and solely relying on the adrenals to produce some of these hormones, you're going to be screwed. So now you get put on bioidenticals. And if you don't do the proper bioidenticals, you're going to increase your risk, or you can increase your risk for cancer again. So women, like, I feel so bad for what you go through. And I had this thought in my mind. I'm like, you know what? This doesn't have to do with like PMS or PMDD, but I'm like, listen, they tell women to get on birth control, right? And to cancel their cycle, right? And then we're trying to compete or have women compete in men's sports. We're trying to have women compete in men's jobs. Okay, there are certain jobs where I wouldn't want a woman to do. They're incredibly unsafe, and quite honestly, I'd rather a guy die doing it than a woman. It's just my take on it. Like if you're up on a skyscraper and you're building new scaffolding or something, you're like, oh, I just want to put the tip on this thing, and then you fall. Like I'd rather that be a guy than a wife or a mom, right? Anyways, I digress. So we're having this competitive thing, and is it that they're trying to, and then the hysterectomies, right? They're trying to remove every essence of being a woman. They're trying to remove it all. saying breastfeeding is not natural, rip out the reproductive organs, get your tubes tied, get on birth control, get abortions. They're literally destroying the fabric of what women were created to be. And when the majority of these signs and symptoms and these diseases are coming from a stress response due to typically pretty terrible relationships or pretty terrible trauma that women have experienced in their life, they're just ignoring it or band-aiding it, and then we're going to turn you into a zombie. We're going to put you on some Xanax, some Ambien, make you fall asleep, and when you wake up in the morning, pop a Xanax, and you're just going to be completely numb throughout the day. You're going to be just walking dead like, I hate my life, but just another day in my body. And then you turn 40, 50 years old, take your reproductive organs. You're on a new list of medications. You got restless leg syndromes. You got fibromyalgia now because you've got abuse and you're still kind of like a battered dog. So you have extra tender points. Women, I feel for you. And this is one of the reasons why I wanted to do this video. It's not just a one size fits all, which is unfortunately what my friend wanted to see. Like, hey, what supplements would you give for PMS or PMDD? Or postpartum. And she had some things, right, where she was like, hey, you need some magnesium, some B6. Sure. All those things can help with estrogen detoxification. Magnesium citrate can help with bowel movements, so it can help with regulating any type of constipation, which in turn can help to reduce beta-glucuronidase production in the body. So can those things help? Sure. But they can be Band-Aid supports, right? Can they help in a time being? Yes, but it's a holistic mixed with allopathic. It's like allopathic functional medicine. It's just really like what functional medicine is. It's like, I'm going to give you medicine, but read your test functionally. I don't agree with that, which is why I made my own little brand of naturopathic health expert. So there's many things that we can do to help aid in these pathways. And something that I'm seeing in my notes here, I wanted to make sure I addressed because this is actually something that this particular patient was going through. Mold toxicity. Okay, mold toxicity can do any type of symptom you could possibly think of, from literally nothing to you're dying of cancer. You can have Alzheimer's, Parkinson's, everything. It can completely destroy and decimate the body. It's like a plague of the body. Okay, certain molds can increase your estrogenic expression. All right, mycophenolic acid is one of them. Okay, it can also increase issues with gut, candida or yeast overgrowth in the gut. Right, because mold is a fungus, yeast is a fungus. They kind of like the same environments, like the same diets, they like the same sugars. So if you're a woman and you're like, you know what, I clean mold up out of my bathroom every single week, just keeps coming back, or you have relatives over and they smell it, like that smells terrible, right? I had a patient telling a friend of theirs, I won't say who and who, but they're like, you're gonna need to test their house for mold. Because when I go over there, it smells like mold. It smells terrible. I'm like, oh, perfect. I appreciate that because I can't go into every single one of my patients' homes because all of my patients are virtual, right? It's one of the unique things about what I set up here is I can have unlimited freedom to help people in any place that they could possibly need it. It's a beautiful way to work. So if you're listening, like, hey, I want to work with you, reach out. We'll work together. But if you're dealing with mold and you have biotoxin illnesses due to mold, or if you have implants in and you're having biotoxin illness or breast implants illness due to that, these are things that we need to address. These are things that we need to adjust. Okay. Now, in terms of supplements, yeah, you can bind out certain molds. There's a brand of product that I like. It's from a brand called Altuo, ALTUO, and it's MoldDtx or MoldDtx. Great company, great people, great creators, great product. So that's something for like, I don't know what the hell to do. I think I have mold toxicity. Take it. They have a 2-week guarantee. If you don't feel better in 2 weeks, you can get your money back. So that's a support for mold. But when it comes to the phases of detoxification, there's certain things that can help. Calcium D-glucarate is a great supporter for phase 1 detoxification of estrogens, as well as lowering beta-glucuronidase. We can have vitamin D. We can have magnesium. We can have B6. We can have all these other things that you can take, probiotics, okay, magnesium citrate again, to get the bowels moving and to get the bowels regulated. But in order for you to truly, truly, truly find out why your body expressed this symptom or this disorder to begin with, comes down to proper testing. So no matter what your age, gender, no matter what your age, you can run this test. Okay, as long as you're past the age of puberty, right? As long as you've at least hit puberty. But I would love for everybody to be able to test their kids, get them when they're, becoming of age. And that way you're able to not only do that, track their cycle, give them the best quality of life, make them the best students possible, help them handle their stress, teach them what health truly is. So that way 10 weeks, 10 months, 10 years from now, they can look back and be like, you know what, Mom, Dad, that diet sucked. But super glad you taught me about that, right? Because now I'm in control of my hormones. And I know when I eat that pizza, I'm going to feel terrible, but the inflammation will wash away in a couple of days. And I know what I need to do to bounce back from it. Now, I am not encouraging binge eating food as you're taking care of your health. I'm not encouraging that at all. I'm encouraging people to take health back into their own hands because your doctors are not going to do it for you. Your medical doctors aren't, your endocrinologists aren't, your oncologists aren't, your fertility specialists aren't, right? You can't go to a place that has two services to sell, drugs and surgery, and expect to get anything else. It's not going to happen. They don't have the tools in their toolkit. They don't have what we have. They don't have what I coach my docs to have. They don't have those skills. And I got into a battle on TikTok. Y'all can check it out. I don't even know who the account is. It's like a blank account. But he's trying to say, every single person is a part of the intake process. Every single doctor coaches their patients on nutrition. I'm like, excuse me? First off, you used blanket statement. You said every single one, which is a lie to begin with. And second off, I have not once had a patient come to me and say, hey, my doctor wanted me to try this diet out. It didn't work. So unfortunately, they had to give me medication. No, not even for fertility. I've had patients come to me and they haven't even run hormones yet. Any tests at all. When you're like, let's do this, let's do this, let's get you on Clomid, let's get you on HCG, let's do suppository progesterone, let's get this, and let's get you scheduled for an egg retrieval. It's like, what the hell? You don't even know what we're working with yet. So test the body, figure out where your body's at. And if you're serious about correcting these types of problems, let me help you. Reach out and we can work together on getting your life back on track because nobody should have to deal with this. And in a way, it's fortunate. The world is fortunate that women are the ones that have these symptoms. And I'll get to the reason why, because women are tough as shit. You guys are way tougher than us. You birth babies out of these little teeny tiny holes and your bodies expand to let the baby out. If a guy experienced any of these things, we would just be crying and whining 31 days out of the month, 365 days a year. Like it would be embarrassing. But it still doesn't mean that you should have to suffer with these things. So if it is something that you're looking to correct and you're looking to change, we do have the Rupa Health Store that you're able to purchase tests if you want to through my account. You don't have to meet with me. Or if you want to do a deep dive and see if there's any extenuating circumstances that we need to think about, whether it's mold toxicity testing or some other form of test, then we can jump on a call together and do a deep dive, figure out who you are and ask those questions. So we build the puzzle of who you are, why your body is expressing this a certain way. We assess your relationships, we assess your body, we look at the neuroendocrine system, we look at the GI, we look at your detox, and we get you results, which is all you guys want, right? You want results. You want to know that when you do something that you're going to get the results that you're paying for. That's what we do. That's what makes us unique and different. And we don't stop until we find the cause. The only way that just doesn't work is if you don't follow through. If it becomes too hard. And I put air quotes of too hard because I give in too easily to social pressure. My friends want me to come out and drink. Or, I love pizza. And so I'm going to have pizza every day and I'm going to do this. I'm like, well, you're not going to succeed. You're going to see me for forever. And eventually you're just going to get pissed off at me because you're not getting results and you're paying a lot of money to do it. Right? So really, you're not a good fit for a patient. So really, I only want people who are at a place where listen, I'm willing to do whatever it takes to invest time, money, and effort into my health because those are the patients that get results 100% of the time. So if you want to join me, find me. I'd love to be able to help. And hopefully this video did a great job of educating on what PMDD is, kind of how it differs from PMS, and then some simple things that you can try on your own if you want to help to influence those certain pathways to get your body back on track. Okay. And if you just want a quick supplement to something you can use, there's FemGuard+Balance on my supplement shop too. If you go on my Instagram page, you can get into it. FemGuard+Balance has a lot of those ingredients in it, which should help to buffer all 3 phases of the estrogen detoxification. But remember, we're band-aiding it. I'm not trying to have you band-aid, but I don't want you to suffer. So any other questions, feel free to reach out to me. Find me on Instagram, DM me. I'm happy to answer any questions. I love these topics, and we'll talk next time.